Welcome to The Explainer. Today, we're going to talk about prescription opioids and a really big side effect that somehow is still flying completely under the radar.
So let's just start with a number. Somewhere between 5 and 8 million Americans are on long-term opioids for chronic pain. That is a massive number of people who depend on these drugs every single day.
But what if I told you that there's this major side effect, and a whopping 76% of general practitioners, they don't even know about it? Yeah, you heard that right. The very doctors prescribing these meds are often in the dark about this. And this brings us right to the heart of the matter, a really common but pretty much hidden problem for a lot of men taking these medications.
It's a mouthful, but it's called opioid-induced androgen deficiency, or just OIAD. And what it means, in simple terms, is that using opioids over the long haul can basically cause a man's testosterone production to just crash.
And we are not talking about some rare fringe issue here. Not at all. Depending on the drug, the dose, the patient's age, studies show this affects somewhere between 20 and a staggering 80% of men on chronic opioids.
Okay, so how in the world does this even happen? How does a painkiller end up hijacking the body's entire hormone factory?
Well, it all boils down to this communication network in your body called the HPG axis. And the easiest way to think about it is like it's the body's thermostat for testosterone. It's a super finely tuned system that's supposed to keep everything in balance.
And normally, it's a pretty straightforward three-step process. Okay, so first, the hypothalamus, which is at the base of your brain, it sends out a signal. Then step 2, the pituitary gland gets that signal, and it passes the message along by releasing some other hormones. And finally, the testes get that message, and boom, they start making testosterone. Pretty simple, right?
Well, here's where it all goes wrong. Opioids jump right into that chain, and they shut down the very first signal, right at the source in the hypothalamus. It's kind of like someone just went and cut the wire to the thermostat. The whole system just powers down, and testosterone production basically grinds to a halt.
So what happens when that system gets shut down? I mean, when testosterone levels totally tank, it's not like it just happens in a vacuum. It sets off this whole cascade of consequences all throughout the body.
And according to a pretty recent review, the effects we know about are, well, they're extensive. We're talking about everything from sexual dysfunction and losing body hair to much more serious stuff like low bone mass, which means a higher risk of fractures, and just a huge negative hit on mood and your overall quality of life.
And check this out, because this is a really cruel twist. A man takes opioids to reduce his pain, right? But the low testosterone that results from it might actually make him more sensitive to pain. Studies suggest testosterone actually has pain-blocking properties. So when those levels drop, it could totally undermine the very reason he's taking the medicine in the first place.
So the connection seems pretty clear, doesn't it? Low T leads to all these bad symptoms. Well, a brand new study just came out that adds a really fascinating and kind of puzzling twist to this whole story. So some researchers in Norway studied almost 300 men who are on long-term opioid therapy. And what they wanted to do was look at the direct link between their testosterone levels and two super common, but also kind of vague, symptoms: fatigue and psychological distress.
So first off, they found exactly what you'd expect. A full 80% of the men in the study had low testosterone. No surprise there. But here's the puzzle. When they actually crunched the numbers, they found absolutely no statistical link between those low T levels and whether the patients felt fatigued or psychologically distressed.
I mean, to put it in their own words, the connection it wasn't there. And that finding really messes with the simple story we thought we knew. That low testosterone is the direct cause of these general feelings of just not being well.
So what on earth does this mean for doctors and for patients? Well, it means we have to get a lot smarter and a lot more nuanced when we think about diagnosing this condition.
Okay, so the huge takeaway here is that we really need to separate the types of symptoms. This study suggests that these really general, non-specific symptoms, like feeling tired or being in a down mood, they're just not reliable markers on their own. They could be caused by a million other things, right? The focus really needs to be on the more specific symptoms, things like low libido or loss of body hair. Those are probably much better clues that you're dealing with a real androgen deficiency.
So, to wrap this all up, OIAD is definitely a real, common problem. But diagnosing it, it's tricky. You can't just rely on someone saying they feel tired or distressed. It's just not enough. You absolutely need a careful evaluation that focuses on those specific signs, and it has to be backed up by consistent blood tests to get it right.
And that really leaves us with this final thought. It's easy to measure a number on a blood test. That part's simple. But figuring out what that number truly means for a patient's quality of life and separating it from all the other noise, that's the real challenge facing doctors and patients now.